Welcome everybody. I am Dr. Rigoberto Tapia, working for Healthcare Alternative Systems, providing education and training to clinical staff. Today we are going to talk about methadone. What should participants must discuss with their healthcare provider before taking methadone? 1. Symptoms of their condition that bother them the most. 2. If they have allergies to any medications. 3. If they have thoughts of suicide or harming themselves. 4. Medications they have taken in the past for their condition, whether they were effective or caused any adverse effects. 5. If they experience side effects from their medications. Some side effects may pass with time, but others may require changes in the medication. 6. Any other psychiatric or medical problems they have, including a history of liver disease. 7. All other medications they are currently taking, including over-the-counter products, herbal and nutritional supplements, and any medication allergies they have. 8. Other non-medication treatments they are receiving, such as talk therapy or counseling. Their provider can explain how these different treatments work with the medication. 9. If they are pregnant, plan to become pregnant, or are breastfeeding. 10. If they use illegal substances or narcotics. Description and indications of methadone. It is a Schedule II synthetic opiate full agonist. It is structurally unrelated to morphine that works in the brain to treat people who are addicted to opioids and narcotic pain medicines. Opioids include heroin and prescription pain relievers such as hydrocodone, oxycodone, morphine, and fentanyl. Though methadone is in the same family as opioids, its long activity in the body makes it suitable for reducing cravings for other opioids and easier to taper a person off of these drugs. It is important to combine methadone treatment with counseling and other support. 1. Used in medically supervised opiate withdrawal and maintenance programs. For opioid use disorder, methadone is highly regulated and cannot be prescribed or picked up at an outpatient pharmacy. 2. Methadone is also used for the management of painful conditions that have been difficult to manage with other treatments. It may be available on an outpatient basis if prescribed by a pain doctor. Benefits associated with methadone use. Methadone reduces opioid craving and withdrawal and blunts or blocks the effects of illicit opioids. What is the most important information participants should know about methadone? 1. Do not stop taking methadone unless directed to by their physician. 2. Do not stop taking methadone, even if they feel better. Prescriber will assess duration. 3. If methadone is stopped abruptly, they may have withdrawal symptoms such as sweating, shaking, nausea, vomiting, diarrhea, body aches, anxiety, irritability, or runny nose. 4. Missing doses of methadone may increase their risk for relapse. 5. Respiratory depression or slowed breathing and death can rarely happen when methadone is taken as prescribed. This risk is increased when methadone is injected into the body or when it is mixed with other depressants including benzodiazepine medications and alcohol. 6. Do not inject, shoot up methadone. This can cause uncomfortable symptoms including respiratory depression, slowed breathing, or death. 7. Methadone is sometimes used as a pain reliever. There have been deaths reported in people who have never used opioids before after using methadone. 8. Methadone is not recommended in people with severe liver disease. Liver injury is rare and this can be monitored through blood tests. They should alert their doctor if they experience any yellowing of their skin and/or eyes, severe stomach pain, or severe nausea or vomiting. Risks associated with medication use. 1. Methadone can be addictive, so it must be used exactly as prescribed. 2. Patients taking methadone may develop heart-related effects that can lead to irregular heartbeats, which can cause sudden death. 3. Methadone may cause serious, life-threatening, or fatal decrease in breathing. 4. This medication has an opiate drug in it. The FDA has found that the use of opiate drugs with benzodiazepine drugs or other sedating medications can result in serious adverse reactions including slowed or difficult breathing and death. 5. Patients taking opioids with benzodiazepines, other sedating medications, or alcohol may start to experience unusual dizziness or lightheadedness, extreme sleepiness, slowed or difficulty breathing, or unresponsiveness. 6. Methadone causes physical dependency when taken daily for a long period of time. 7. This means that you may have withdrawal symptoms if methadone is stopped abruptly. They should talk to their provider before stopping methadone. 8. High risk of accidents while driving or operating machinery when taking methadone. Common side effects. headache, nausea, vomiting, lightheadedness, dizziness, sedation, increased sweating, constipation, and swelling in the arms and legs or peripheral edema. Signs and symptoms of withdrawal from opioids such as shaking, stomach cramps, diarrhea, restlessness, irritability, anxiety, insomnia, body aches, or runny nose. Rare, serious side effects. 1. Orthostatic hypotension, or low blood pressure when standing. 2. Irregular heart rhythms. 3. Changes in liver function or liver failure. 4. Allergic reactions. Overdose and death. Signs of overdose include pinpoint pupils, sedation, low blood pressure, and respiratory depression or slowed breathing. This risk is higher when methadone is injected or used at the same time with sedatives like benzodiazepines or other depressants such as alcohol. Contraindications. 1. Opioid analgesics with some opioid antagonist activity such as buprenorphine can displace methadone on mu-opioid receptors and cause acute withdrawal. 2. Opioid antagonists such naltrexone and naloxone interaction displaces methadone on mu-opioid receptors causing severe acute withdrawal. 3. The antidepressant monoamine oxidase inhibitor is contraindicated due to potential adverse reactions. 4. Tramadol, a synthetic analgesic, has an anecdotal withdrawal potential. Missed doses. If they miss a dose of methadone, they should take it as soon as they remember unless it is closer to the time of their next dose. They are not supposed to double their next dose or take more than what is prescribed. Implications of diet when using methadone. Participants should talk to their doctor about eating grapefruit and drinking grapefruit juice while taking this medicine, because grapefruit increases the potency of any opiate that is metabolized in the liver, which can lead to toxicity including CNS adverse effects and potential QT prolongation and torsades de points when high doses of methadone are used. How should patients take methadone? Methadone is available as an oral tablet or liquid. Methadone tablets should not be crushed, chewed, or snorted because of the risk of overdose and death. A single dose of 20 to 30 milligrams is usually used to decrease withdrawal symptoms. Lower doses should be considered in patients with low tolerance at initiation. An additional 5 to 10 milligrams of methadone may be provided if withdrawal symptoms have not been decreased or if symptoms reappear after 2 to 4 hours. Total daily dose on the first day should not exceed 40 milligrams. Their doctor will decide when and whether to change their dose. Their doctor will adjust their dosage to one which prevents withdrawal symptoms for 24 hours. Are there any risks for taking methadone for long periods of time? Methadone causes physical dependency when taken daily for a long period of time. This means that you may have withdrawal symptoms if methadone is stopped abruptly. Participants should talk to their provider before stopping methadone. How long does it take for methadone to work? Methadone will begin working shortly after taking one dose, in about 30 to 60 minutes. What should participants avoid while taking methadone? Avoid drinking alcohol, using sedatives, or other opioid pain medications, such as codeine, hydrocodone, oxycodone, or morphine, or using illegal drugs while they are taking methadone. They may increase adverse effects of the medication such as sedation, overdose and death. Keep in mind that some cough syrups may contain opioid pain medication. Participants should discuss all medications with their doctor and pharmacist prior to taking methadone. What happens if participants overdose with methadone? If an overdose occurs, they must call their doctor or 911. They may need urgent medical care. They may also contact the Poison Control Center at 1-800-222-1222. Naloxone, Evzio injection or Narcan nasal spray can be used to reverse overdose from opioids including methadone. You should always call 911 after giving someone naloxone to treat an overdose. What other medications may interact with methadone? There have been reports of respiratory depression or slowed breathing, and death in patients taking methadone with benzodiazepine medications such as Xanax, Klonopin, Valium, Ativan, and Restorol. These medications should be taken exactly as prescribed. It is very dangerous to take methadone with benzodiazepines if they have not been prescribed. Remember that using methadone with antipsychotics, tricyclic antidepressants, and certain heart medications may increase the risk of developing irregular heart rhythms. The following medications may increase the effects of methadone. 1. Certain antibiotics such as Biaxin and Aritab. 2. Certain antidepressants such as Prozac and Paxil. 3. Antifungals such as Diflucan, Nizoral, and Sporanox. The following medications may decrease the effects of methadone. 1. The opioid blocker, naltrexone or Vivitrol. 2. Certain antiviral medications known such as telaprevir, ritonavir, sequinavir, and lopinavir, ritonavir. 3. Certain seizure medications such as phenobarbital, tegretol, and dilantin. 4. The antibiotic rifampin or Rifidin. Summary of FDA black box warnings. Patients taking methadone may develop heart-related effects that can lead to irregular heartbeats, which can cause sudden death. Doctors will ask questions about heart disease and monitor heart regularly during treatment. Methadone may cause serious, life-threatening, or fatal decrease in breathing. Doctors will monitor closely for breathing, especially when beginning treatment with methadone or when increasing your dose. This medication has an opiate drug in it. The FDA has found that the use of opiate drugs with benzodiazepine drugs or other sedating medications can result in serious adverse reactions including slowed or difficult breathing and death. Patients taking opioids with benzodiazepines, other sedating medications, or alcohol, and caregivers of these patients, should seek immediate medical attention if they start to experience unusual dizziness or lightheadedness, extreme sleepiness, slowed or difficulty breathing, or unresponsiveness. Are there specific concerns about methadone in pregnancy? People living with substance use disorders that wish to become pregnant face important decisions and challenges. Active substance use disorders during pregnancy put the fetus at great risk. Discuss the risks and benefits of continued treatment with their doctor and caregivers. Opioid use disorder in pregnancy is associated with adverse outcomes such as low birth weight, preterm birth, and fetal death. However, receiving treatment for opioid use disorder during pregnancy lower these risks. Methadone crosses the placenta and can be detected in cord blood, amniotic fluid, and newborn urine. Methadone is considered the standard of care when treating opioid addiction in pregnant women. Growth deficits, although present, do not appear to last. However, decreased performance on behavioral tests has been found to continue into childhood. Opioid withdrawal symptoms may occur in newborn infants of women who were taking methadone during pregnancy, and there have been reports of poor feeding, diarrhea, irritability, tremor, trouble breathing, low heart rate, rigidity, and seizure in these cases. Methadone is excreted into breast milk. Peak methadone levels appear in breast milk 4 to 5 hours after an oral dose. Sedation and slowed breathing have been reported in nursing infants. If a female participant is nursing, and methadone is used to treat opioid addiction, breastfeeding is likely to be safe as long as monitored by a pediatrician and the baby is tolerating